that came to learn some things. I do a lot of talks in this office. I do talks on the endocrine system, thyroid, functional medicine, nutrition. But this talk that I'm going to do tonight is like the main course of what I do in my office, okay? So it's called How to Not Short Circuit Your Brain, or the Importance of the Nervous System in Health and Disease. All of a sudden, my computer is not responding. Okay, here we go. So, if you look at your nervous system, it's a lot like a safety pin. And when you look at a safety pin, I want you to remember this. This is the brain and this is the body. Your body is connected from the brain by loops of communication. And it's like a subluxation, which is what we treat, interferes with this communication. It's a disconnect into the system. So these loops of communication go from the brain to the body, body to the brain to the body, body to the brain. All primary care doctors who care for people with the intention to enhance and express their health and their life understand and know this. So if you look at what happens in the body sends messages to the brain, letting it know it's experiencing. The brain sends messages back to the body, telling the body how to adapt. These are loops of communication. This isn't just like a chiropractic theory. This is basic functional neurology. Okay, so if you burn yourself, that information automatically goes to your brain. Your brain tells your body how it's supposed to react to it, and your body does it accordingly. The same thing if you sprain your ankle. You sprain your ankle, your brain gets that information. It tells your body to start the inflammatory process to protect that ankle so you don't sprain it anymore. So these loops of communication are constantly going on in your body. Anyone who does not know this or respect the efferent and afferent pathway is violating one of the fundamental laws of life. So I'll tell you can remember this. The efferent pathway, I think of like this. Efferent bubbles bubbling out of your brain into your body. Okay, that's the efferent pathway. The afferent pathway is the communication from your body to your brain. So how important is a nerve supply from the brain to the body? So let's look at three scenarios. Bad scenario number one. The French developed the guillotine. When the head is severed from the body, the individual dies instantaneously. Why is that? Because you can't go for 1 second without communication from your brain to your body. You can live for 60 days without food before dying. You know, some people can live a lot longer than that, depending on how heavy they are. You can live for a week without water if you start well hydrated. You might be able to live for 2 minutes without air, but you can't live for 1 second without the communication from the brain to the body, that energy that the brain produces, that electrical energy. So again, bad scenario number two, a partial severing of nerve supply from the brain to the body. We all know what happened to Christopher Reeve, tragedy, okay? So his spinal cord was severed at C2, or was partially severed at C2, so he's paralyzed from the neck down. Bad scenario number three, subluxations interfering with nerve supply from the brain to the body. And this is exactly what we treat as chiropractors. A minor subluxation, misalignment, cutting off nerve supply, can cut off 60% of the nerve flow to an organ or muscle. Now, what do I mean by minor subluxation? The weight of a dime. If you put the weight of a dime on a nerve, that will cut off 60% of the nerve supply to an organ, okay? Isn't very much, okay? By the way, the person who discovered that was a researcher by the name of Chung Ha Su, who discovered that in the 1970s. He was the only person in the world at the time that was doing research on chiropractic, and he's at the University of Colorado in Boulder. And he found out that just a minor misalignment irritating a nerve can cut off 60% of the nerve flow to an organ. So what we do in chiropractic, we correct subluxations. That's essentially what a chiropractor does. A subluxation will destroy your spine if it's not corrected. So anybody in here, probably most of the x-rays that I have of you were not degenerated because of your age. But if you have a subluxation long enough, that will give you osteoarthritis of the spine. You may not even know that. You may not even realize that it's happening, because you can have problems in your body for a long time before your body starts giving you symptoms. But if you let that go, that will start destroying your joints and your spine, and I've seen it many, many patients. So the origin of life is triggered by what happens in the central nervous system. The brain is constantly doing its best to get the body to adapt, to help the body maintain as much health and life as possible. So there's no evidence that a healthy brain can create sickness in the body. Is there evidence, let me ask you this, is there evidence that an unhealthy body can create a sick brain?
Yeah.
Everybody's shaking their head yes.
Mm-hmm.
Yeah, that's right. You know why? Because the brain, in many ways, is downstream from what's happening in your body, okay? So the brain, though, is constantly trying to adapt to what you do. So let me ask you something. If you constantly eat junk food, is that a healthy way to live?
No.
No, it isn't. But if you do, and lots of people do, the brain is constantly trying to adapt to that, to keep the body as healthy as it can be until it can't do it anymore. Then what happens?
You die.
You die, or you start getting sick. Okay.
Yeah.
I'll tell you an interesting story. And there is this woman, this girl, this 16-year-old girl in England, that just collapsed one day. They took her to the emergency room. They couldn't figure out what was wrong with her. She didn't have any pathology. And when they questioned her mother told them that the only thing she'd eaten since she was 2 years old was chicken nuggets. That's all she'd eaten. Her body tried to adapt, couldn't. At 16, it couldn't adapt anymore. So it just collapsed, stopped working. So they saved her, but she had to start eating something other than chicken nuggets. Okay? That was actually in the news several years ago. So if you look at the central nervous system starts with two cells, sperm and egg, which divide exponentially. The first thing that happens is you get what's called a notochord. Okay, that becomes the brain and the spinal cord. It's the first thing that develops in the body during the development of a human being. What happens next once the brain and the spinal cord are formed? Anybody know? What happens after that?
Heart.
Okay, heart. The organs develop. The brain, the spinal cord sends nerves, and the organs develop on the ends of those nerves. The brain actually directs development of the baby, the organs in the baby. That's why it has to be formed first. Okay? So finally, organs grow off the nerves directed by the brain. So the brain forms first because it directs, controls, and coordinates the development of the person. So the body tries to protect things appropriately. So we have vital organs that protect our ribs, okay? But for our central nervous system, it's completely encased in bone. By weight, bone is 9 times stronger than steel.
Ooh.
You think that's a coincidence? No, no coincidence, okay? Now, subluxations have been described in 4 different ways, all right? So A subluxation can be described as a dysfunctional movement of a joint irritating a nerve. That's how we normally think of it. But it's also been described as an inflammatory process of ligaments and discs and other tissues surrounding the nerves, where they exit from the bones. So do you think that ligaments can become inflamed? Yeah. You ever seen a football player sprain the ligaments in his knee out on the football field?
Yeah.
They have to cart him off, okay? Yeah, there's a lot of inflammation that goes on. So that can happen in your spine as well. It can be an outright compression of a disc. You can actually see this on an MRI. Now, the interesting thing about this is that just because you see that on an MRI does not mean that that's what's causing the pain. Some interesting studies that were done on MRIs over the last 20 years. And what they found is that it used to be that they saw an MRI, they got an MRI, and they had a disc that was compressing a nerve. They go, that's it, that's the problem. So they trimmed the disc off the nerve, and guess what? The patient woke up and they were no better. Because it isn't necessarily, that can be a compensation for what's happening in the body. It doesn't necessarily mean that that's causing the problem. Okay? And the last way to describe a subluxation is a change in the electromagnetic charge from an inflammatory response, which changes an alteration in tone in the electrical field. Doesn't matter how you describe it. People that have subluxations don't do as well as people that don't. So let's look at some of the things that chiropractic does. Chiropractic adjustments change processing in the prefrontal cortex. That's a part of your body that makes executive decisions. The prefrontal cortex is involved in mental health, immunity, inflammation, the endocrine system, gastrointestinal system, pain and stiffness, sleep, blood pressure, heart rate, attention, and focus. So let me tell you, if there's one thing that I want you to understand about chiropractic, I'm going to tell you right now. We are central nervous system doctors. That's what we do. We affect the central nervous system, and we do it through the spinal column. We're not bone and joint doctors, okay? Do we work with them? Yes, but we're affecting the central nervous system. Here's a bunch of studies that were done, all done by Heidi Habak and her team, that found that when you adjust somebody, you change proprioception, you change hand-eye coordination. It gets better. So if you take a kid that's just clumsy all the time and you start adjusting them, guess what? They get more coordinated, okay? Because we know that chiropractic changes hand-eye coordination. It's called proprioception, okay? So the prefrontal cortex, this area right here, is kind of like the conductor of the body. In chiropractic care, we know from electrophysiology studies, affects that. So the scientific evidence proves that people with this form of dysfunction, when adjusted, they do better. Now there's three ways to look at chiropractic. I don't believe in chiropractic. Anybody ever heard that?
Yeah.
Yeah, okay. Yeah, I did. Yeah, I've heard it. You know, why do people say that, by the way? Why do people believe that? Anybody?
That experience.
They don't believe chiropractors are doctors. They don't call them a doctor because they don't prescribe medicine or don't do surgery.
They don't believe it because they don't understand how the body works.
Yeah.
That's why they don't believe it. If they understood how the body works, it'd be very different. Okay? So chiropractic is only good for pain relief. Did anybody that you know think that? Yeah. Yeah, you go, you're hurt, you get,
yeah.
Okay? And then there's a third way of looking at it. Chiropractic enhances the way my entire body works, and thus the expression of life and organ function. That's really the way that chiropractic works right there. So chiropractic is not designed to make you instantaneously feel better. That happens. Doesn't always happen, but it's designed to make you instantaneously heal better. Okay? So if you study the loop between the brain and the body, do you think that a liver that's trying to detoxify needs information to travel at 100%? Yeah, okay? Because the liver needs nerve supply. By the way, what part of the spine does the nerve supply of the liver come out of? Anybody know?
Thoracic?
Stand up, Jason.
C6?
Okay, it's this area right here. This is the liver.
Thoracic.
Oh, thoracic.
Now the heart and the lungs come from up here. So if you have a problem up here, that can affect the heart and lungs. You have a problem here, that can affect liver, gallbladder, and some of the other visceral organs. Thank you. Does the heart require 100% nerve flow? Yeah.
Oh, yeah.
Oh, yeah, it does. Let me ask you another question. Does a heart require specific nutrition to work properly?
Oh, yeah.
Yeah,
Yeah.
it does. Okay.
Yeah.
Now I have some other professionals who would almost disagree with that, but yeah, it does. It requires very specific nutrition. Can anybody name me one mineral that the heart needs to work right?
Potassium?
Good job. Yeah, potassium, magnesium, sodium. Okay.
Yep.
All right. So Keith Wasson, who's done a lot of work with chiropractic, said that thinking of chiropractic only as pain relief is like robbing a bank and stealing only the pens. And some of the way the banks, anchor their pens with those chains, they don't want you to take
No,
them.
you can't take one, yeah.
They act like they don't at least. So what are some other ways that back pain is dealt with? Now, number one is cortisone injections.
Mm-hmm.
Okay, so what does cortisone do?
Kills the pain.
It numbs the nerve.
Numbs the nerves. It reduces inflammation. Okay. Does anybody know what the side effects of cortisone are?
Well, it wears off. It don't last very long.
Yeah, so cortisone injection is really crisis intervention. It's not health care. Because if you shoot cortisone in somebody's body, and I'm not saying that should never happen, but you're not making the person healthier. You're just getting rid of the pain. So this is a study, December 2019 study in the journal Radiology, major medical journal, stated the following regarding steroid injections. It actually accelerates osteoarthritis in the joint. It causes complications of osteonecrosis, which is the actual death of a joint where the bone actually starts dying. And it can cause rapid joint destruction with bone loss. Now, does that happen every time somebody gets a cortisone shot? No, but it happens enough times to where they know that this is can be a major side effect of cortisone injections. That's right out of a radiology journal. So the chiropractic process may be a little slower than cortisone, but it's in tune with what your body needs to feel safe. So is there a reason that your body gives you pain? Yeah.
Tell you something's wrong.
Yeah.
Yeah, it tells you something's wrong. That's exactly right. So if your oil light goes on in your car, what are you going to do? Are you going to just punch it out and say, okay, oil light's gone, we're good. I did that when I was a teenager, and it was not a good result. Okay, I didn't punch out the oil light. I just didn't pay any attention to it.
Blew the engine, yeah.
Yeah, blew the engine up. Yeah, bad experience, okay? Just tell you that. Bad experience for our whole family.
Yeah.
Okay, so your body gives you pain for a reason. So covering up symptoms makes no more sense than spray painting over the oil light if the oil light comes on. Symptoms are there for a reason. And we cannot pretend that the nerve pathways are okay when your body's giving you symptoms. So, as I said earlier, research has shown that a minor subluxation can shut down 60% of nerve flow. Now, here's something that I want you to understand as well. Only 10% of your nerves deal with pain. Okay, 10%. Okay? What do the other 90% do? Madeline?
Information and function.
Yeah, function. Yeah, good answer. They deal with function. So they allow your liver to work. They allow you to lift weights. They allow you to see and hear. They deal with function. So what does that mean for our health? What does that mean if 10% of our nerves deal with pain and 90% deal with function? What are the implications of that?
By the time you have pain, you've already done more damage.
That's a pretty darn good answer, Alexis. Here's what I would say. I would reframe that answer in a little bit differently, that you can lose a lot of function and have no pain and not even know it. Okay? So can anybody here give me an example of that in real life? Of that happening to somebody? Anybody in here ever know somebody that had stage 3 or 4 cancer that had no symptoms?
No.
Yeah.
They went to the
I was going to
doctor.
say leukemia.
Yeah. They
Yeah.
went to the doctor, got a blood test. It was all screwy, so they did some imaging. They had stage 3 or 4 cancer.
Mhm.
How many people have known people that have just one day fell dead over a heart attack and didn't know they had a heart problem? I have. I've known people like that.
Yep.
So that's a major loss of function, and the first symptom was death. Okay, major loss of function, and you got cancer. So what I'm trying to say is that the amount of pain that we feel isn't necessarily an indicator of health. Can you have a lot of symptoms and have that be a totally healthy response? Anybody? Can anybody give me an example of that? Anybody ever had food poisoning?
Yeah.
Yeah. So, it comes out of both ends. That happened to me when I was in Haiti years ago. Okay? It's a totally normal response. You have major symptoms, but it's a very healthy response. Your body's trying to get rid of the toxicity.
Mm-hmm.
So, an individual who has a nerve that is as free of interference as possible can fight off infections or sickness much easier. Let me ask you this before we get into kids here. Did anybody in here know somebody that went through the COVID epidemic that never got COVID? Anybody know anybody didn't get COVID?
Mm-hmm.
It happened.
Yeah.
It happened.
I
So
did.
why didn't they get COVID? Maybe their body was functioning at a higher level. Okay, so when you're as free of nerve interference as possible, you can fight off infections a lot easier. Let's look at kids. So do kids get subluxations?
Yeah.
Yeah.
Yeah. You have about 4,000 falls and bumps when you're a child before you get to adulthood. So do they cause problems? Absolutely they can. Kids tend to get chronic colds, allergies, behavioral issues, ear infections, sore throats. That's how they express subluxations. Okay? When you adjust kids, they're a lot healthier. I see a lot of kids in my practice. So, and they're a lot less complicated generally than adults are, because they don't have all the degeneration that adults do. So this is an article in a very prominent neurobiology journal in 2014. And here's what it said. Very interesting. It looked at the upper cervical area of the spine, this area right here where the spinal cord comes out of the brain and goes through the upper 2 bones of the neck. And says these nerves have a great influence on cardiovascular and respiratory area. Stimulation of these areas can influence cardiovascular and respiratory areas. They also influence the entire autonomic nervous system. And I see problems in this area all the time in people. Okay? In fact, you can see it in people. Anybody ever? I saw this on TV the other day. There's this woman, this young woman, probably 30, news anchor, and she sat there, and she when she relaxed, her head did this. Okay, I thought that woman's subluxated. She's got some problems. Her head she didn't even realize it. She'd relax and her head would just crank over to one side. You can see that in people. You look at their posture. Look at the way their head sits on their body, and you can see stuff like that. So this is one of the reasons it's difficult to understand how chiropractic can work is because we're dealing with the nervous system, the autonomic nervous system that people are not that familiar with. And so some people say, do you have to go back to chiropractic over and over for the rest of your life? No, you don't have to. You can stop anytime. But people go back because they want to be healthy. You know, we don't brush our teeth just when they hurt, right? Some people do, but you know, it's not a smart thing to do, okay? So why do we brush our teeth?
Prevent.
Yeah, we want to prevent, we want to hang on to them. I want to hang on to my teeth until I die. I want to hang on to my joints until I die. You know, I don't want false teeth. That's the last thing that I want, okay? So we brush our teeth to prevent them from falling out and decaying. That's why we get adjusted. We get adjusted to keep our spine and nervous system as healthy as we can. So, Tour de France riders, do you know they get adjusted every day after every cycle? They have a chiropractor that works on them. Animals get adjusted. Racehorses get adjusted. Why do horses get adjusted?
Peak performance.
Yeah, they run better. Okay. And I've adjusted horses, but I've adjusted a lot more dogs, and guess what? Dogs are healthier and they function better when they're adjusted. They don't limp as much. Their bodies work better. They have more energy. So animals have a nervous system too. So their animals are healthier and they live longer when they're adjusted. So as doctors of chiropractic, as a doctor of chiropractic, I don't want to adjust you just to get you out of pain, even though that's probably what drives most people to my office. I adjust people because it's the right thing to do. You drink water, you drink more water, you hydrate yourself because it's the right thing to do. You take supplements. You don't take supplements generally because you're in pain. You take them because you want to stay healthy and stay out of pain. You want to stay as well as you can. So my goal is not to get you out of pain, just to get you out of pain. I want to do that, but I also want to teach you to take better care of yourselves. I want to teach you to understand that the brain-body processes requires this 100% afferent pathway from your brain to your body. And this is not someone's theory or opinion. The evidence is overwhelming. A properly functioning nervous system will give us a great chance of being as healthy as possible as we get older. Okay, and I don't know about you, but I want to be healthy as I get older. Does anybody in here know of people that are getting older that are not healthy? Oh yeah, they're out there.
Yeah.
A lot of them.
Yeah.
Okay. I don't want to be in that category. I don't want any of you to be in that category either. So once we get you out of pain and get your nervous system functioning, we want to keep you that way. Now, some people can do that once every 2 weeks, some people once a month, okay? Depends on how your body, depends on the particular individual. But there's a lot of people out there that are sick, that don't know what to do, they don't know where to turn, they're taking pharmaceuticals. And the question I have is, who do you know like that? Who do you know that is in pain or that's sick a lot or they get sick a lot? They don't know what to do. They don't know where to turn. Who do you know that's like that? Those are the people that I would like to see. Those are the people I like. Those people just need to get checked. They need to find out, is their problem being caused by a subluxation? And we can do that with leg length, range of motion, palpation, and posture check. You can check people's posture too. In fact, I'm going to do a talk on posture and health a few months from now. Okay, but you can look at posture and tell if somebody's postured off. Do you ever see somebody that when they stand, they look like this?
Yeah.
Okay.
Yeah.
What do you think's happening internally to them?
It's just slowly morphing.
Yeah, they have a lot of spinal pressure, a lot of pressure on their nervous system. It's like that lady on the TV show I saw, about 30 years old, and she's cocked her head to the side like this. thought, that woman, if she doesn't have problems, she's gonna have some problems. So here's what I want you to do. I want you to think of somebody and then just talk to them. Tell them about what I talked about tonight. You know, and we're gonna post this talk on YouTube, okay? So you can take them to this talk and show them, hey, it might be your nervous system that's causing your health issues. And if it is, we might be able to help them. Okay? Now, that's all I have for tonight. It's 7 o'clock. Does anybody have any questions about what I've talked about? Nobody. Clear as mud, huh? All right, great. Thank you very much for coming tonight. In 2 weeks, we're going to be talking about the thyroid. Why do people's thyroids go haywire? Why do so many people have thyroid dysfunction? And what can be done about it? What do we do about it in our office? How do we test for it? How do we treat it? You know, why are there other alternatives to treat thyroid other than levothyroxine? You're going to find that out in 2 weeks. Okay? Great. Thank you so much for coming tonight.